Hi, my name's Lee Matthews and I'm a specialist pain physiotherapist. I work in pain management here at Queen's Hospital, and today I'm going to guide you through some exercises for rehabilitation of a muscle in your back that's really important. It's called multifidus, and they're really small muscles, but don't underestimate their importance for things like low back pain. These muscles actually sit between each of the segments of our spine, so when we go to do movement they actually help to control and stabilise. Sometimes when we've had pain for a long time, when you look at an MRI you can see they've deconditioned. Sometimes there's what we call fatty infiltration as well, so that nice strong muscle becomes weak and not as good as what it's designed to do. And sometimes what we also find is that some of the bigger muscles that cross multiple joints can actually then start to get overactive and compensate for it, and this can actually lead to things like muscle spasm happening as well. The good news is that if we do exercises we can strengthen those, but in doing so it takes a lot of time, it takes consistency with that as well, and they're very specific exercises, and that's why I'm going to give you some guidance today. So positioning is everything, don't strain too hard with these things. And because it's muscle strengthening, in terms of frequency and duration, I'll be looking at you doing about 10 repetitions, and obviously go to the guidance you've been given by your physiotherapist, but I'd be often looking for people to do them more than once a day, so 2 or 3 times a day, aim for 10 of each. Hopefully these are the sort of exercises you can do within about 5 or 10 minutes, so it's an investment. It takes time, but actually we know that if you strengthen this, it can significantly impact on improving people's circumstances, allowing you to function in your normal day. And you'll often find that people have fewer days where the back pain's really severe, so they have more good days. So it's definitely something worth investing in, but it does take time and awareness of doing the right exercises for them. So let's get started. I'm going to use my plinth here. At home you might use an exercise mat or a rug on the floor. I'm going to go into a position of 4-point kneeling. Those same principles can be used to do them in standing, holding onto a worktop as well. So let me guide you through them in 4-point kneeling, and then I'll show you some adaptations that you might introduce if you're not so good in a kneeling position. So first of all, let's bring ourselves onto the plinth. So bring yourself into a crawling position, or we call it 4-point kneeling. I'm looking for the shoulders to be directly over where the wrists are on the bed. I'm looking for my hips to be directly over where the knees are. And if you've got a mirror at home, like a big mirror wardrobe, it might be helpful to have some feedback by being able to look into the mirror. What we're looking for with the back position, I'll roll up my t-shirt a little bit so you can see. We're looking for a nice level position with the spine as well. So a bit like what we did in laying out with some of the other exercises, I can arch my back one way, I can curl it the other way, but what I'm actually looking for my spine is that nice mid position where we're in a nice neutral posture there. So that's going to be our start position, and I want you to imagine throughout that you've got a tray of drinks balanced on your back there, that you don't want to spill a drop of them. So rather undignified now, our first exercise once we've found that neutral position is I'm going to let my belly hang down, so no one's watching you at home, let your belly hang, and then I'm going to just try and draw my belly button up towards the ceiling. So that action of just gently trying to engage that corset of muscle there is going to also help to engage those muscles that we're interested in. So we found that neutral position, and now engaging those muscles will help to reinforce that posture there. And a bit like when we were laying on our back or laying on our front, we can then increase the demands placed on there by doing some alternate movements with the legs and with the arms. So from this position, the first thing I'm going to do, my first exercise, is going to be engaging the core, and I'm just going to try and do a very small knee lift just off of the plinth and then back down again. And I'm going to alternate from one leg to the other. So here we go, I engage that muscle, I keep that nice curve of the back, and lifting the other knee just a couple of millimetres clear of the surface I'm resting on. Same again, engage the core muscle. And all that time, when you're doing this, imagine that tray of drinks that's balanced on your back is not going to spill a single drop. So now we're going to use those principles and we're going to apply them to the following exercises. We're going to engage the multifidus more by actually using an outstretched leg. I'll show you the easiest version and then I'll show you a progression for this. So here we go. first of all, I scoop up my tummy button, I keep my back in that nice neutral position, that long neck, and then I'm going to bring one of my legs out, the toes are still on the ground there, and I'm going to hold for about 10 seconds, and then coming back in again. And then we do the same on the other side. So again, scoop the belly button up, keeping that nice neutral spine, and bringing the leg out behind us. So that's one on each side. I'm going to be aiming to do about 10 on each leg for this one. And it's all about control and posture throughout. So that tray of drinks that's balanced between our shoulder blades, that tray of drinks that might be balanced on your lower back area, you want to imagine that it's totally still and that you're not going to spill a drop of them. And the progression to that is to do exactly the same thing, but this time with an outstretched leg that's off of the floor. So here we go. Again, find that nice neutral position. You found that middle ground there for the spine. Let's engage that tummy muscle, and this time that leg comes right out behind me. And again, keep that tray of drinks completely still, like you're not going to spill a drop. And after about 10 seconds, I come back in again and do the same on the other side. Now, it's really important to keep a nice level pelvis through this. Sometimes there's this temptation to draw the leg out and try and lift up too much, and that's not what we're looking for. I want it to be more subtle than that, more controlled, so that throughout this is remaining nice and level where the belt line of your shorts are. And back down, and the same on the other side. And throughout, we're just engaging those tummy muscles, lifting that tummy up towards the sky. And back down. So again, if we're looking at strengthening the muscle, ideally we'll be looking at about 10 of these in a row. Again, picking the right variation for what's good for you. If you can't maintain control and stability, you should be sticking with the easier versions and not trying to progress there. We've done these for the legs, and you guessed it, we're going to do a similar variation for the arms. So again, find that nice neutral position, keep your spine in that nice gentle curve in the lower back. We engage the core muscle, and the easiest variation for the arms is to just tap the floor or the plinth just in front of you, and then do the same on the other side. So here we go, and back down again. And the whole time we do this, we're just trying to make sure that shoulder blade stays down towards your back pocket on the arm that you're resting on, and then the same on the other side. So again, keep your shoulder blade down, engage that tummy button, up and out. And you can feel it working. If you can't feel that, then you're doing better than me, but we're just trying to engage those core muscles, and we're also strengthening around the shoulder blade area as well with this one. And back down again. So we can progress upon that by actually doing the arm lifting out and away from us. So let's do that now. So again, shoulders in a good position, long neck, nice neutral posture. I draw my tummy button in, and now what I'm aiming to do is a lift of the arm out and away from me, and then back down again. And the same on the other side. So here we go. That's good. I'll do a couple more on each side. And again, neutral position, engage your tummy muscle, shoulder blade in your back pocket, arm out and away from us. So we can increase the demands even further by doing alternate arms and legs together, and that definitely is a significant progression there. So again, go on the advice of what your physio is giving you, but let's get into those positions, shall we? So here we go. So I find my nice neutral posture. I'm going to find that lumbar neutral position. I scoop up my tummy button, and then what I'm looking to try and do, extending one leg away from me, extending one arm away from me, and I hold and sustain. And if there's a tray of drinks on your back, they might be wobbling a bit, but hopefully you don't spill a drop. And then when I've done one side, I'm going to do the same on the other side. And it's all about control and posture. If when you're doing this, then you're kind of wobbling all over, you're probably better to stick to the easier version, yeah? And back down. And the same again. And again, in terms of frequency and duration, I'm aiming to hold for about 10 seconds. I'm looking to try and do about 10 of them in a row. And ideally, you know, if you could build up towards doing 2 or maybe even 3 sets a day, that would be fantastic. And back down again. So it might be with the 4-point kneeling that you struggle a little bit with lifting up your own body weight, and that's where a gym ball can come in handy. I'm going to do them on the plinth that I've been using. If you're at home, I'd be suggesting that you use an exercise mat on the floor with the gym ball on it. You tend to find on carpets and shiny floors, this can slip around, so it's much safer to use an exercise mat underneath it. So if I pop my gym ball on here, and what I'm looking to try and do is support my tummy on the gym ball there. So this is just going to give me a little bit more support there. And again, it just takes some of the weight off of my arms and allows me to focus on stabilising and keeping the legs in a good position without quite so much effort through the shoulder blades. But I still need to make sure my shoulders are in a good position. Long neck, let's think about the position of our low back. And again, if I engage the core, and now what I can do is lifting one leg out and away from me, hold for about 10 seconds, and then back down again. And then the same on the other side. And back down. So this is another way of doing it. This is a little bit more comfortable. But again, we're still looking for good control and stability. And imagine that tray of drinks on your back is there held perfectly still, and you're not going to spill a drop of them. And not only can we do the legs in this position, we can also do the arms. And it does require some effort still, and you're a bit wibbly wobbly potentially, but that's where control and stability of those muscles comes in, and it uses our core. And then obviously we can still do the same progressions again of doing alternate arms and legs. You just tend to find, although there's some instability there, it just takes a little bit of the weight of your body off the arms and the legs, and if you're struggling a little bit to support yourself, it can just be a kinder way of doing the exercise, but it still requires a certain level of control. And if you're not sure, then it might be that you stick with the ones laying on your tummy to begin with. There we go. And this gym ball is, I believe, a 55. They come in different sizes, and generally most people tend to use the 55 or the 65. They don't cost a fortune, but you've got to be safe and make sure you clear the furniture out of the way first of all. So for some of you, the gym ball might not be an option, and it might be that if you've got bad knees that you don't like kneeling in 4-point kneeling. So we can adapt the exercises to doing them standing upright, leaning on a table, worktop. Your kitchen work surface might be an option. So I've raised up my plinth. I'm positioned with my hands holding the table, my feet are about hip width apart, knees relatively straight there. So what I'm going to do, find that neutral position with my spine. There we go. So find that nice mid position. Shoulder blades nice and back into your back pockets almost. I draw my tummy in, so I'm going to suck that belly button up towards my spine, and then bringing one leg out behind me and tapping the floor, aiming for about 10 seconds or thereabouts. And then back in again, and then the same on the other leg. So again, tapping that floor, keeping that nice neutral position with the back, keeping your tummy scooped in. 10 seconds and back in again. And you keep on going there. The supporting leg is relatively straight at the knee there. Back in again. Now, temptation might be to kind of go a bit wild with the back leg, but we want this to stay nice and level here. So even if you could go further or higher, when I do that, can you see that I've lost the position there? So I want to keep in that nice level position with the hips and keep that belly scooped in throughout. And you're looking for 10 repetitions there. From this position, we can also do the arm exercise as well. So here we go. I'm going to keep that nice neutral position, engage my tummy muscles, and then from this position, reaching your arm up and away from you, holding for 10 seconds or thereabouts. And then the same on the other side. So again, keep your shoulder blade in a good position with that shoulder blade tucked into your back pocket. Bring your arm up, holding for about 10 seconds, and then bringing it back down again. And same on the opposite side. So in terms of frequency, 10 in a row would be a good number, aiming for about a 10-second hold each time. And you might start by just doing them once a day, but really you should be aiming to build up to 2 or 3 sets a day to really help to strengthen that muscle there. And when you've done the legs and the arms in isolation, the same progression can happen as we did in 4-point kneeling, and that's we can bring one leg out behind us and one leg out away from us, and again, good posture throughout, and back down again. Remember, as I said in the other positions, look out for the position of the pelvis, because we want to make sure that it stays nice and level there. There's a temptation sometimes to lift too far, and then we kind of lose that nice stable position of our pelvis. So it's better to do less movement and keep it stable than try and lift too far and kind of go all wonky there. So here we go, holding that position. And back down again. And the same on the opposite side. And then we have it. So that's the exercises that we're aiming for you to do to strengthen your multifidus muscle. I'd be looking for you to do about 10 repetitions because we're looking at strengthening those muscles. What we'd aim to do to begin with might be just once a day, a few times a week, building up to do them daily, and hopefully beyond that looking at a couple of times a day. So hopefully they'll only take about 5 to 10 minutes to do, but we know that physiologically to see change it needs consistency. So try and get into the habit of doing them as part of your daily routine. Aim to do stuff that you can remain controlled but feel slightly challenged as you're doing them. And physiologically, if you do them each day, it's going to be at least 8 to 12 weeks before you even start to see change. And we know that looking at MRIs and things, it can actually take much longer than that to see changes happen, sometimes 6 months, a year, sometimes even a couple of years. So it's worth doing these things, even in the presence of wear and tear changes with our back. We know if we can strengthen the muscles that support our back, it can make massive difference to both our function and our pain intensity as well. And what you might start to notice is you can walk a bit further, stand a bit longer, and it might also be that you have more good days where the pain's less severe, and hopefully over time that can improve as well. So this is sort of exercises that you do each day. It's not the ones you just do when you're having a bad patch. The idea would be that by doing them consistently, you don't have the bad patches so often, and they're less intense and they resolve a bit quicker. So these are definitely worth investing in. Have a go, and thank you for watching.